Welcome everyone to Mind, Body, and Relationship. And today we are here talking with Breanne.
Hello.
Breanne, how about if you introduce yourself?
Okay, as you mentioned, my name's Breanne. I'm a therapist here at the counseling house, and I typically work with children and adolescents and parenting, but I do work with adults with trauma as well.
Oh, okay. And you recently graduated, right? I say recently, but when was that? Time has gotten away from me.
Almost a year ago.
Almost a year ago,
Yes.
Yeah. From Yorkville University,
Yes.
right? Yes. And of course, I'm Dr. Laurie Ponsford-Hill. And today we're going to be talking about something near and dear to your heart.
Yes.
Yes. Something called Polyvagal Theory.
Yeah. So actually what we're talking about is the introduction to Polyvagal Theory of basic understanding, and that's the hand-brain model of the brain.
Excellent.
So Dan Siegel invented a really great way to understand the human brain. It's quite fascinating, and so he kind of likens it to the hand. And it's really important that we understand the brain, because once we understand it, we can, react or respond to our child's needs accordingly, depending on where they are in their brain at that moment. So if we look at our hand and we think about it as the brain, so this would be the brainstem.
Okay.
And this would be the limbic system. And then this would be what we call the prefrontal cortex, or the cortex area. And so the first part that we look at is kind of the limbic system, and that's in charge of very basic, very primitive things. It's been around for 300 billion years. So if you think about a reptile, its instincts are basically for survival, food and survival. So we're looking at, digestion, heart rate, breathing as well. So, and then on top of that, this is where you would see fight, flight, freeze.
Right. Okay.
So those responses. So basically it's all about survival.
Mm-hmm.
And then we move up here and we move into kind of the limbic system. And this is the area of the brain that was developed about 200 billion years ago. So it's still very old. But what we know about this part of the brain is that it doesn't really come online until a child is about 6 months old. So prior to that, everything that children do is pretty instinctive.
Yes.
It's all about survival, getting their food, getting their needs met, those kinds of things.
Yes.
So in this area is where connection takes place. Our emotions, our connection to other people, and attachment to primary caregivers. And this is really predominant, and it kind of runs the show really until kids are about between 6 and 8 years old. It's really in control. So we see kids that are having tantrums and their logical reasoning is not there, right? And so it's really important that we understand this area. It has two main parts. It has the hippocampus and it has the amygdala. The hippocampus is for memory formation. So it moves things from short-term memory to long-term memory. Now the amygdala is really important, and that's kind of what we would call our detector, like our smoke detector almost. It's an alarm system. It tells us when something is happening that is not safe. It makes meaning out of the things that happen, and it stores them in such a way that we can respond to them really, really quickly, so that we don't actually need to think. And this is great. I mean, if you're an antelope in the wild and, a lion's chasing you, this is a great thing to have, because we don't want to think. We don't want to think about, oh, wait, there's a lion chasing me. He might eat me. I should probably start running right now. We just want to run and get going.
Right. Exactly. Just like your finger on the burner on the oven.
Yes. Or you're driving down the street, right? And a kid jumps out in front of your car. You slam on that brake.
That's right.
Before you even think about it. It just happens instinctively.
Automatic response.
Yes. And that's where the amygdala plays a part, because it's created that memory formation, and it allows us to understand or kind of pinpoint those memories and relate to them. So you walk in a room, you smell something familiar, and it brings that that endearing or romantic feeling because it smells like your loved one. Right? Those are immediate feelings.
Right.
So
if it's a good one.
Yeah, if it's a good one, that's right. Now, if you smelled the cologne of somebody who abused you, you're going to have a very different reaction. And you're going to react to that without actually thinking. And this is where this can be a problem.
Yes.
I often liken it to a smoke detector in the house where we want it to go off. We want it there because if our house is on fire, we really want to know that the house is on fire. Unfortunately, in some cases, our alarm system or our amygdala are super sensitive. And what it does is it starts going off when we burn toast. And we don't want it going off all the time. And we're reacting as if our house is on fire each time, but it's not. So that's what's going on in the limbic system there. Then we move up here, and this is kind of what we call the human brain, although I think there's a lot of mammals we could say are smarter. But this is where our thinking is. This is where we map out our senses so, that we're able to kind of put it together. So again, we walk into the house and we smell something and we go, oh, mom's making cookies. We're able to understand where the smell's coming from, and we're able to make memory out of it and meaning from it. And so that's really important. This also is our problem solving. Our language above 4 letters rather. Our ability to understand language above 4 letters and our ability to come up with language above 4 letters. And it's also, this is what integrates everything. It makes sense of everything that's coming in. And the reason why this hand-brain model is so important is so we have the limbic system here, and what we want to see is this. It looks like a brain. We want the prefrontal cortex. We want it on top. We want it to be the thinking brain. We want it to be in charge.
Definitely. Right here.
Yes. Unfortunately, when we're triggered or something happens or we haven't really developed the skills that we need to use this part of our brain and to keep it online, we're like this. And this is not in charge. This is.
Right.
And that's where we see people making decisions or reacting very quickly in situations whenever they feel highly emotional. And doing things over and over and over again. We see this with kids a lot. So the reason why I wanted to talk to you about this particular thing today is that I think that it's really important for parents and people working with kids to understand this part of the brain and all 3 aspects, because once you can understand where a kid is, then you know how to relate to them. So first and foremost, we need to know their developmental age.
Okay. Because
a child that's 2, and if we're asking them to wait to the end of the week to get a reward for something they're doing today, is not going to work out well.
Right.
It's likely going to end in a tantrum because they don't have that concept. That part of their brain is not developed yet. So likely what's going to happen is your child's not going to do what you want them to do. There's going to be a lot of tantrums, and they're not going to trust you because you told them that you would give them something, and they're not getting it because they don't have that sense of time.
Right.
So there's going to be frustration on both ends. However, if you ask an 8-year-old, to clean up his bedroom every day, and at the end of the week you'll take him for a trip to the zoo, as long as he is, a neurotypical kid, meaning that he's developmentally on par, then he or she should be able to do that.
That's really the key, isn't it?
It is.
The developmental bit.
Yes. So I think it's really important that parents are really careful about what they're asking their children to do and whether or not it's something that they're capable of doing.
Exactly.
And not every child develops the same. And so, I have 4 children myself. All 4 of my children did not develop the same. I had some that could dress themselves by the age of 2, and then, my daughter now who's 5, she can dress herself, but I can't guarantee that she's going to have underwear on every day.
That's right, exactly.
So just understanding that every kid, does develop differently.
And we all mature at a different rate.
Absolutely. And we learn differently. We learn things. Some kids are, kinesthetic learners. So that means, like movement and things like that. Some kids read, really, really well because they're visual learners. Right?
Exactly.
Or they might be, auditory learners. So we just need to make sure that we understand their learning styles. The other thing that I think is important to understand is that once we're able to understand what brain region they're in and that they've been triggered, so I think of it as a ladder. This is the top of the ladder, and we go down to the limbic system, and then we go down to the brainstem. It's really important to understand where they are so that you know what you need to do in order to get them back up the ladder.
Very important.
Yes. So if a kid is in the limbic area and this part is, so now they flip their lid and this is offline and they're here, you're going to treat them very differently than if they've now gone down the ladder to their brainstem and they're in fight, flight, or freeze.
Exactly, because there's no thought process going on there.
No, none. So what I like to use are the 3 R's, regulate, relate, and reason. And in those, exactly in those stages. So regulate is first. I talk to parents a lot about the need for them to be regulated in order to help their children be regulated.
Let's all be regulated together.
Yes.
Sometimes a lot more difficult than what you think.
Very hard. When your toddler is screaming at you, and they're crying because their Jell-O is green and they wanted red. And you're sitting there with 2 other kids in the background and they want to go to the park.
Exactly.
And so-and-so is screaming on the floor. It's very hard to stay regulated. And
Of course.
First step is making sure that you yourself are regulated. So do what you need to do to get yourself regulated before you deal with that child.
Maintain the thinking part.
Yes. Try to get back up the ladder yourself.
Exactly.
So, and then especially for children under the age of 8, co-regulation is really important. When I talk about co-regulation, it's simply that act of being with your child in a calm state. And when you're in a calm state, their nervous system will go in line with yours. Children under the age of 8 often have a lot of difficulty regulating themselves. That part of their brain just isn't developed.
Exactly.
And so if you're breathing calmly and not talking, it's really important that you're not talking, or that if you are talking, you're saying something very repetitive and in a very calm voice. So something like, you're safe, I'm here with you. And that's it. You can say it over and over. If the child reaches out to you, then I would say definitely, you can touch them, you can soothe them, you might rub their back. You know what your own child likes.
Right.
If they do not reach out to you, I recommend that you just tell them, I'm here if you need me. I'm here when you want to reach out, because we all regulate differently.
Right, exactly.
Yeah. And so it's really important to respect that, especially when they're in fight, flight, or freeze, because they're reading that situation as threatening.
Yes.
Yes. And we don't want them to feel any more threatened.
Exactly. So just automatic reactivity.
Yes.
Yeah.
They're not thinking, they're not processing anything at that point. So anything you say is kind of like Charlie Brown's wah, 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 wah. Nothing is going in, nothing's kind of coming out, except they might be screaming at you, yelling at you, those kinds of things.
Homer Simpson.
Yes. Other things you might see in fight, flight, or freeze that are, so if we're looking at fight, right, we're looking at aggressive behavior.
Yes.
Kicking, screaming, throwing things, that kind of stuff. Flight is often kids that are trying to run away. When we talk about flight in adults, we're actually looking at addictive behaviors. Stuff like drug use, overeating, other eating disorders, anything that kind of allows you to kind of numb out. Looking at dissociation as well, which is a disconnection to reality. Avoidance, very much. That's what it is. And then when we think about freeze, we're really thinking about kids who are kind of frozen in place. I think of a deer in the headlights. Their eyes are often big. They look fearful. There's no language. They might be mumbling.
Yeah.
Not a whole lot is coming out.
Lack of movement.
Not able to follow instructions. Very simple instructions. And what they're saying probably, if they are saying words, it's not making any sense.
Confused.
Very confused. So when they're down in this area, again, we're regulating them.
Right.
We want them to move up that ladder. It's really important that we allow children, or even adults, the full time that they need to regulate. There's no schedule for it.
Exactly.
You can't say, in 20 minutes I gotta go and you need to be completely regulated, right? It doesn't happen like that. And the more pressure that's put on them, the less likely they are to actually be successful at it. And you probably aren't regulated if you're rushed. So try and take that off the table, if at all possible. And the next level would be relating. First and foremost, that's helping them to reorient to the present.
Okay.
When people are in fight, flight, or freeze, they're not in the present moment.
No.
They're back to the moment that they felt threatened. And so for somebody who's had a lot of trauma in their lives, they may be going back to that initial trauma. But even if it was something that just happened, 10 minutes ago, that's still where they are if they're in this area here.
So true. Yeah. So back to developmentally, could be years.
Absolutely. So, some of the kids that I work with, when I see them bouncing back and forth, and you'll see them kind of moving up and down the ladder, and the way that I often can tell, there's two things. It's eye contact. If they're not making eye contact with me, that means they're definitely in this lower level here.
Right.
If they usually make eye contact. Now, it's normal for them. Some people don't like to make eye contact. And,
very vulnerable place, yes.
Yeah. And then the other thing is you'll notice that their language is offline, or that when they're speaking, they become very juvenile. They regress. They almost sound childlike. Their language is childlike. The tone is childlike. And so their ability to kind of articulate what they're thinking is not there at all. So they're almost like a very young toddler-like.
Baby talk.
Yeah. So when we move up to the limbic system here, what we're trying to do is we're trying to relate. So we're trying to get that connection and that attachment back online.
Right.
So the way to do that is really a lot of attunement. So that's where, you're paying attention to them and what they're doing and what their body language is telling you, and you're responding in an appropriate way. So now they're pretty regulated, but they're still not, they're not processing things. So the language might not be, up to where it should be. So some things that I like to do with kids when they're in this limbic state is we do a lot of grounding exercises together.
Oh, okay.
So passing a ball back and forth without any talk is a really helpful way, because they have to pay attention to you in order to catch the ball, right?
Definitely.
And they have to pay attention to you to know where you are in order to throw the ball. And so it doesn't require a lot of thought, but it certainly helps them to attune to you and to recognize that you're attuning to them and their needs.
So true. Now they're paying attention.
Yeah. Coloring is a great way, right? So giving them some markers and just letting them scribble on a piece of paper. Sometimes even just saying, like, color how you're feeling. You're angry. What color would that be, right? And they'll pick up, the red or the black or whatever, and they'll just scribble. That can be really helpful. Painting. Finger painting is really good because it's sensory based.
Right, tactile.
Yeah. There's a yoga pose called legs up the wall, where you lay on your back and you put your feet and your legs up the wall, so you're almost like at a 90-degree angle. And that actually works really well, and kids think it's pretty funny.
I bet they do.
Yeah, but it calms the nervous system. So doing that with them, holding their hand if they want to, right? Just massaging their hands, putting hand lotion on them can be really helpful. Passing an ice cube back and forth. Yep. So kids think that's funny, right? Throwing it back and forth and just passing it. What does it feel like? Getting all their senses back online. Really important, right? What do you smell?
Oh, exactly.
What do you see in the room? Can you find 5 blue things?
So just paying attention to surroundings.
And then the last one after relate is reason. And this is where, when this the prefrontal cortex is online, that's when we can start reasoning with our children. Now, a lot of people think that this can happen immediately.
And
it doesn't, because just because they've gone up the ladder doesn't mean they can't go back down.
Exactly, yes.
And so we really want to give them enough time to be firmly having this online.
Right.
And I often say to parents, if it happens in the morning, wait until the evening to have that discussion. Sometimes a lot of difficult times happen at night, with children in particular. So I say wait till the next day.
Oh, okay.
Yeah. And then really talk. And, consequence has to be taken off the table. And it doesn't mean that there are no consequences, because I believe in consequences. I think they're really important. But I also think that, learning is the most important part.
Right.
We want them to learn from the experience. So make sure that when they're talking to you, that you're really listening, and that you're not trying to teach them, but you're allowing them to learn the skills and to process what happened. And so, and then at the end, right, talking to them about what they think would be appropriate, and talking together about, what they would do next time and how they could do it differently.
Right, yes, the planning.
How could I have been different in that situation? What would have helped you more in that situation? So asking them to be the problem solvers.
Very good.
Because they know better than anybody probably what they needed. Yeah.
And also, if they were able to connect,
yes,
they'd be able to do that.
Exactly. I mean, we all want to connect. We all want our, our rational brain online. We don't want to be feeling that way. Nobody wants to be feeling that way. Children are the same. It's not a nice feeling to be out of control. But worse than that is to have the people that you love and that you feel safe with, yelling at you and, punishing you in those moments of distress, because it doesn't help you to learn how to regulate.
No, and it's very difficult too when it is that you're telling a child to be different than what it is that they are, right? Because then negative cognitions get set in, like I'm not good enough, right? Not important, that sort of thing. So you want to avoid that as well. Yeah. And,
the more we use this part of our brain, and we help our kids to use this part of our brain, it allows the whole system to integrate. And integration really is well-being. I mean,
it's the key.
It is the key, right? When we can understand why we're doing what we're doing, when we can observe ourselves, and to be able to say, I just walked into a room and that smell kind of brought me back to a bad time, and some of the emotions that came up were fear and anger and frustration, and I don't have to react that way because I'm not there anymore.
Nor hide it.
Exactly.
Yeah.
And to be able to articulate it and to be able to understand it. And that's our job, as parents and people who work with children. It's to help them to integrate all parts of their mind.
Exactly. That really is the key, right?
It absolutely
Mind, body,
is.
Relationship.
Yeah, there you go. Regulate,
there you
relate,
go.
and reason.
There you go. Exactly.
Yeah.
And I think really at this time too, because you're a teacher, that was your prior professional persona, right? Now a lot of parents are at home actually doing that.
Oh, it's hard right now.
Yes, exactly. And it doesn't take much sometimes when there might be a subject that is somewhat overwhelming.
Absolutely.
Let's just say math, whatever that might be, right? And that could be for the parent too, with the new math, like not even knowing how to do it anymore.
My husband is still teaching, and he has his math specialist. And some of the homework that our grade 12 and our grade 10 bring home, he's confused by it.
Oh, I can imagine.
He's overwhelmed. He teaches up to grade 6, so he's not teaching high school, but still, it's very complicated.
Very complicated. And I find that one of the things that really does get in the way is the agenda, the time agenda to get things done.
Absolutely.
And when it is that we're talking about this, right, when you have someone who becomes dysregulated so easily by the overwhelm of whatever it is that topic or subject might be, then of course becomes the pressure of getting it done.
And they just shut down. And that brain isn't on anymore, and they can't even think and process to do the work that they need to do anymore.
Exactly. So any helpful suggestions?
for that,
Yeah.
I would say, I always say that mental health is more important than your children's grades at the end of the day. And just, taking a look at the work and just deciding, do they need to get all 50 questions done, or could they do, maybe 3 from each section so that they understand the concepts, giving them breaks.
Yes.
Breaks are really important. A child, even myself, I work for an hour, if I'm working on something at home or like an essay or reading or whatever, I work for an hour, and then I always take 10 minutes just to kind of do whatever, because I need to give my brain a break. And sometimes I think that we expect our children to be better than we are, in the sense that we expect them to recover and regulate themselves and to be able to do schoolwork and everything, right? Perfectly all the time, and we want them to like get up and do their chore now, right?
Yep.
Whereas we're sitting there going, well, I know the dishes need to be done, but you know what, I'll do them in the morning because I don't feel like doing it right now.
There you go.
We give ourselves permission to recognize when we're overwhelmed, or to manage our time, and we need to remember that our children are learning how to do this too. And so allowing them, giving them a time frame that they need to do things, so they don't need to do it immediately, encouraging them to take breaks, and just reminding them that nobody ever checks your grade 4 grades.
No employer will.
No, I tell parents this all the time. When was the last time somebody looked at your grade 4 grades?
Exactly. Yes.
Kids all learn. We all learn differently, and that's okay. I am terrible at geography. Don't ask me. I've learned the geography of Canada several times. And I had to teach it. So I would learn it before I had to teach it, and then I would teach it, and it would be gone out of my brain by the next time I had to teach it. It just didn't click for me,
There you go. Exactly.
And I was okay with that. And we have to be okay with our kids where things just don't click for them. And that's okay.
So true.
We just, it's important that they don't feel like a failure. Kids who, when they feel like they're failing at something, they're less likely to try.
Yeah.
And so just, encouraging them and letting them learn however they learn, and that growth is growth, no matter how small.
So true, so true. And the truth of the matter is that, we feel the time pressure.
Absolutely.
Right? They don't necessarily feel that time pressure. And the truth is that conflict happens when things become very, very fast.
Absolutely.
Right? So it's about really slowing it down.
Absolutely.
Right? Asking the questions, finding out where it is that the child is at, or your spouse is at.
Yeah.
In order to, of course, create a plan.
Yeah.
Right? So that everybody is still thinking.
Yeah, and being flexible.
Oh, exactly.
Right?
Yes.
Things are not always gonna, you're gonna have good days and you're gonna have bad days. Your children are gonna have good days and your children are gonna have bad days. And just accepting that as a part of who they are, not as the end of the world.
There you go. And to have a reward system.
Absolutely.
Yeah. Yes.
They don't need stickers necessarily, but whatever works for them. Each kid is different.
So true. And if you're the parent, reward yourself. You're doing a good job.
It's true. We're doing better. Most parents are doing better than they think.
There. Exactly. Right?
Yeah.
So really good to keep that in mind.
Yes. And what you see on social media from your friends is probably not accurate. Don't compare yourselves to them.
No, definitely.
Behind that clean kitchen is a completely disorganized living room.
There you go. It's just that they're spinning it. Well, thank you so much, Breanne, for coming and joining us today. That's fantastic. And thank you for joining us today as well. If you have any questions, please don't hesitate to reach out, give us a like, right? And join us next time. Thank you so much, and bye for now.